Welcome to another deep dive. Today we're going to be looking at pregnancy and childbirth,
Okay.
specifically through the lens of what EMS providers need to know.
Right.
Now, we've got a few different sources for this deep dive.
Okay.
We've got some excerpts from an EMS textbook.
Mm-hmm.
We've got a really interesting training case study,
Uh-huh.
and we've got some lecture notes.
Okay.
And one of the things that really stood out to me when I was reading through all this material
Yeah.
was just how much a pregnant woman's body changes.
Oh, yeah. It's really incredible.
That's not just the growing belly, right?
No, not even close. I mean, think about it. Blood volume increases by like 50%.
Wow.
Clotting happens faster. The heart's working 20% harder.
It's like a whole, body transformation.
It really is.
So what's the reason for all these changes? Is it all just about, making space for the baby?
Well, I mean, part of it is about the baby, sure, but really it's about getting the body ready for delivery. Especially thinking about potential blood loss. It's like a built-in backup system.
So it's not just about, nurturing new life. It's also about safeguarding the mother.
Exactly. And here's where it gets really interesting. All of these changes that we're talking about,
Yeah.
they can actually mask signs of shock in pregnant trauma patients.
Really?
Yeah.
So, what might look like normal vital signs
Right.
could actually be a sign that something's seriously wrong.
Exactly. A heart rate of 120 beats per minute, that might be, a clear sign of shock in a non-pregnant patient.
Yeah.
But in a pregnant woman, that could actually fall within the normal range.
Oh, wow. So that's a really important point for EMS providers to keep in mind.
Yeah, absolutely. I mean, recognizing these physiological differences is really essential to making sure that both the mother and the baby are safe.
Now, speaking of recognizing crucial signs, our training case study throws us right into a pretty tense situation.
Yeah.
We've got a pregnant bank teller. She's 1 week past her due date.
Mm-hmm.
She's starting to experience distress, and she's also dealing with preeclampsia.
Right. This case really highlights how important it is to understand preeclampsia
Yeah.
and how serious it can be.
Yeah.
It's more than just swelling in the hands and feet, like a lot of people think.
So break it down for me. Preeclampsia, I know it's not good,
Yeah.
but why is it so dangerous?
Well, at its core, preeclampsia is all about dangerously high blood pressure.
Okay.
And we're talking about potentially leading to seizures,
Yeah.
which is known as eclampsia. And, like we were just talking about, it can also mask signs of shock.
Wow.
Which makes it even harder to diagnose and treat.
So it's like one thing leads to another.
Right.
And what seems like, maybe a minor pregnancy complication can actually escalate into a really serious situation.
Exactly. And it really underscores why you need to have expert care throughout a pregnancy.
Yeah. Now, going back to our bank teller for a second, the case study mentions that her amniotic fluid is green.
Oh, right.
Which, I gotta admit, that sounds kind of weird.
Well, that green color is actually really important because it tells us that there's meconium present in the amniotic fluid.
Okay. Meconium, isn't that just a fancy word for baby poop?
It is.
Okay.
Meconium is fetal stool. And if we see it in the amniotic fluid, that could mean that the fetus is in distress.
Oh, wow. So it's not just about, a messy delivery or something.
No.
It could be a sign that there's a potential breathing emergency for the baby.
Exactly. Meconium aspiration during delivery, that's a really serious risk. It's something that EMS providers need to be ready to deal with.
Okay, so we think we're getting a handle on things, right? We're going through this training scenario,
Right.
and then, bam, another curveball.
Yeah.
We're in the middle of what seems like a totally normal delivery. The baby's head is out, and all of a sudden we see the umbilical cord wrapped around the baby's neck.
Yes. The neutral cord. It's one of those situations that can get pretty stressful quickly.
Yeah, that sounds terrifying. So what do you do in that situation?
So the first thing you want to do is, assess the situation, see if the cord's loose enough that you can gently slip it over the baby's head.
Okay.
But it's really important to remember that clamping or cutting the umbilical cord,
Yeah.
that's not something that should be done out in the field.
Right.
That needs to be handled by medical professionals at the hospital.
So even when everything seems to be going smoothly, complications can still pop up.
Absolutely. There's really no such thing as a routine delivery. And it's important to remember that the birthing process deserves a lot of respect.
Now, here's something that really surprised me when I was reading through the materials.
Okay.
The dangers don't necessarily stop after the baby's born.
That's right. The postpartum period has its own set of risks.
Yeah.
There are two main postpartum complications that EMS providers need to be aware of:
Okay.
excessive bleeding
Okay.
and pulmonary embolism.
Okay. So excessive bleeding, I mean, that makes sense, right? But a pulmonary embolism after giving birth? I don't really understand that.
Well, let's break it down a little bit.
Okay.
Excessive bleeding,
Yeah.
which is also called uterine atony, that happens when the uterus doesn't contract the way that it should after the delivery.
Oh.
There are a few reasons why this can happen. Maybe a really long or difficult labor, delivering multiples, even having pieces of the placenta left behind.
So the uterus is basically like exhausted
Yeah, pretty much.
and it can't clamp down properly.
Exactly. And that can lead to, a lot of blood loss for the mother, which obviously can be really dangerous. That's why something like a uterine massage can be so important.
Oh,
It's more than just a routine procedure. It can actually prevent a really dangerous situation.
what about pulmonary embolism? You said that's also a risk.
Right. So remember all those clotting factors we talked about earlier?
Yeah.
Well, those can stick around into the postpartum period. And if a clot happens to form in the veins, it can actually travel to the lungs, which causes a pulmonary embolism.
And that's really serious. Right?
Oh, absolutely. It can be really serious. Some things to watch out for: sudden shortness of breath, chest pain, even a sudden change in mental status.
So that's something to keep in mind, not just for EMS providers, but for anybody who knows someone who's recently given birth. Right?
Exactly. I mean, the postpartum period needs just as much attention as the pregnancy itself.
Wow. This is a lot to take in. It's amazing how much is going on during pregnancy and childbirth.
It really is a complex and fascinating process. And honestly, we've only just scratched the surface.
Yeah, that's true. Well, this is a good place to pause for a minute and let our listeners absorb all of this amazing information.
Welcome back to our deep dive.
All right, so we've talked about all the crazy changes that happen in a woman's body during pregnancy.
Yeah.
And we've also started to touch on some of those potential complications that can happen. But one thing that really jumped out at me in the EMS textbook was just how much emphasis they put on the whole idea of fetal distress.
Oh, yeah, for sure. I mean, you got to remember we're talking about two patients here.
Right. It's mom AD, baby.
The mother, Andy, the baby. Exactly.
But how do you actually, figure out if a baby's in distress? I mean, it's not like we could just ask them, right?
Right. Well, I mean, that's where, careful observation comes in and a really good understanding of all the signs and symptoms.
Okay.
Remember that green amniotic fluid we were talking about earlier?
Yeah, the meconium.
Yeah, that's one sign. But there are other things that EMS providers need to be looking for, too.
Like what?
Well, fetal heart rate is a big one.
Okay.
A normal fetal heart rate should be somewhere between 120 and 160 beats per minute.
Okay.
And then anything outside of that range,
So too fast or too slow, basically.
yeah, could be a cause for concern.
And what about, fetal movement? Does that play a role?
Oh, absolutely. Yeah. Usually a mother can tell if something's different with her baby's movements.
Right.
And if there's a decrease in those movements,
Oh, okay.
that could mean that something's wrong.
It's almost like the baby's way of trying to communicate that something's not right.
Yeah. I mean, they can't use words, right?
No, exactly.
So that's why it's so important for EMS providers to talk to the mother
Yeah.
and really get a good history. I mean, she knows her baby better than anybody.
That's true. It's like a team effort.
It is.
You've got the mom's insights, and then you've got the EMS provider's expertise.
Exactly.
And when you put those together, you can really make a difference. Now, speaking of teamwork, communication with the receiving hospital is also super important.
Oh, absolutely. It's critical. We're not just transporting a patient.
Right.
We're transporting two lives.
That's a good point.
So the hospital needs to be ready.
For anything.
For anything. They need to know how far along the pregnancy is, if there have been any complications, is there meconium present, what position is the baby in.
It's like passing the baton, making sure all that important information gets to the right people.
Yeah, exactly.
So you can have the best possible outcome.
Right.
All right. Let's circle back to those lecture notes for a minute. They talked about some different types of abnormal deliveries.
Yeah.
And I thought it was interesting how they pointed out that some of them, like a breech presentation,
Right.
are just way beyond what an EMS provider can handle in the field.
Yeah, for sure.
Could you explain what a breech presentation is?
Yeah, so basically it just means that the baby is positioned to come out feet first or bottom first.
Okay.
Instead of head first.
Okay.
And in those cases, getting to the hospital as quickly as possible, that's really all you can do.
Okay. Now, what about something like a neutral cord?
Yeah.
Where the cord's wrapped around the baby's neck. We talked about that earlier. Can EMS providers do anything about that?
Yeah, so if the cord is loose enough, they can try to gently slip it over the baby's head.
Okay.
But remember, clamping or cutting the cord. Right, absolutely not a field procedure. You got to know your limits.
You do.
Know when to step in and know when it's time to let the experts at the hospital take over.
Exactly.
Now let's talk about postpartum complications again.
Okay.
We touched on excessive bleeding and pulmonary embolism.
Right.
But there was one more condition that the materials mention.
Oh, yeah. There's one more that's really important to remember, and it's actually one we've already talked about. Preeclampsia.
Wait, preeclampsia can happen after the baby's born, too.
Yeah. That's not as common.
I thought it was only during pregnancy.
It can happen up to 6 weeks after delivery.
Wow.
So even when everything seems fine,
Yeah.
you got to stay vigilant.
The postpartum period, just as important as the pregnancy itself.
Couldn't agree more.
It's amazing, how much we're still learning about all of this.
It is.
It's not just about delivering a healthy baby.
No.
It's about making sure that the mother is healthy throughout the entire experience.
A whole journey from start to finish and beyond. I feel like we've covered a lot of ground here.
We have a lot to think about.
Our listeners are probably like, whoa, this is a lot.
Yeah. But you know what? There's still more to come.
Right. Stay tuned for the final part of our deep dive, where we're going to be exploring even more surprising insights about pregnancy and childbirth. We're back for the last part of our deep dive, and I think we've saved some of the most interesting stuff for last.
I think so, too. One thing that really stuck with me was the whole idea of cultural sensitivity.
Oh, yeah.
When it comes to obstetric care.
It's so easy to get caught up in all the medical stuff.
Right.
That you kind of forget.
Yeah.
That this is a really personal experience for women.
It is, and the textbook was talking about how women from different cultures, they might have certain beliefs and practices. So, EMS providers really need to be respectful of those differences.
It's about, meeting people where they are.
Exactly. For example, some cultures might not be okay with a male healthcare provider examining a female patient.
Right.
Or, there might be certain rituals or traditions that are really important to the mother.
So it's really about listening and understanding and being flexible, making sure that every woman feels safe and comfortable.
Absolutely. And it's not just about respecting different cultures either.
Right.
It's also about, realizing that certain groups, like teenagers, might face some extra challenges during pregnancy.
Oh, yeah. Teen pregnancy.
Yeah.
That's a whole other layer of complexity.
It is. Teenagers, they might be scared or confused. They might not even believe that they're pregnant.
Yeah.
They might not want to seek help. They might not have any support.
So EMS providers really need to approach those situations with a lot of empathy.
Yeah, tons of empathy.
Yeah.
Just create a safe space for them.
Okay.
Yeah.
Before we wrap things up, you said you had a couple more fun facts to share.
I do. Did you know that during pregnancy, a woman's body actually produces a hormone called relaxin?
Relaxin.
Relaxin. And it helps her ligaments relax.
Oh, so it's like nature's way of getting the body ready for childbirth.
Exactly. Helps prepare the pelvis for delivery. But here's the thing. It doesn't just affect the pelvic ligaments.
Oh.
It affects ligaments throughout the whole body.
So that's why pregnant women often have, joint pain and stuff.
Exactly. And here's another one for you. Remember that, white, cheesy substance that's on newborns? Vernix caseosa.
Yeah, it's kind of weird looking.
Well, that actually protects the baby's skin while they're in the amniotic fluid.
Oh, wow.
Acts as a barrier against infection and helps regulate their temperature.
It's not just random goop.
Yep.
It has a purpose.
It does.
I feel like this deep dive has really been a journey.
It has.
I mean, we've learned about all the incredible changes that happen in a woman's body during pregnancy.
Right.
We've talked about some of those, hidden dangers that can pop up.
And
I think, we've all gained a new appreciation for just how complex this whole experience really is.
I think so, too. And the more we learn,
Yeah.
the better we can care for mothers and their babies.
But before we go, I want to leave our listeners with one final thought.
Okay.
We talked about how the physiological changes during pregnancy can make it really tough to spot the signs of shock.
Right.
So how can EMS providers be extra careful?
Yeah.
How can they make sure that they're not missing those subtle signs in a pregnant patient? It's something to think about. And on that note, thanks for joining us on this deep dive. We'll catch you next time.